Hey everyone, welcome back to the Dr. Shayna Show. This week we have a special guest, Dr. Jinmee Graham. She is a colleague of mine from Bastyr University, and we're going to be talking about tis the season of what we most likely call immune dysfunction, but actually, is it more of a susceptibility because of a number of things? And I'll have Jinmee go ahead and introduce herself and kind of break out into susceptibility versus something's wrong with the immune system.
Right. Hi, Shayna. It's great to be here with you. So I'm Jinmee Graham. I have my naturopathic doctorate and master's in public health from Bastyr University. So as Shayna mentioned, we went to school together. And I'm really excited about this topic because I'd love to see more of the naturopathic philosophical laws and principles in a public health conversation. It would be very valuable. So you do that a lot on the podcast. So I'm excited to jump in.
Yeah, I love that you also have an MPH, a master's in public health, because it gives you that extra bit of credential that says, "Hey, like we're not just talking about this, and we're quack jobs out here. We've put a great deal of thought into these, and you know, I I did an ask on Google, and like we have the AI that pops up with we don't have to dig deep into the internet. And so it's like if you type in fever management, it's going to tell you to take Tylenol or ibuprofen, suppress the fever. It's going to tell you to take cough syrup if you have a cough, suppress, suppress, suppress. Just that's creating comfort. And in that comfort, are we creating something worse? Right. And so fevers, coughs, flus, colds, all these things, it's kind of tis the season for it. But I really want to, let's just open the can of worms. Like we're kind of talking about germ theory versus terrain theory. And is this just simply because we have a weak immune system and everybody's going to get sick? Or is there maybe a couple other things that we're missing that we haven't added to the conversation yet?
Yeah, so let's start there. I think if we can pull up the germ theory versus terrain theory table, I think that will be a good start and introduction. And so essentially, modern medicine, conventional medicine, is basically kind of on the backs of germ theory. And so if we look at this table, what are the differences? So germ theory is pretty much the cause of disease is thought to be from specific pathogens or microorganisms, right? So your bacteria or viruses. And they are considered the primary causes of infectious disease. So naturally, the prevention and treatment then would be to kill or remove the pathogen, the bug, to come back to healing and restore health. So this is
Mhm.
where most of our modern therapies come from: antibiotic therapy, vaccinations. This was all rooted from this germ theory approach, and it's largely followed by mainstream medicine today.
Mhm.
However, there's a whole nother conversation here regarding terrain theory, and I'll talk a little bit about how we see both of them integrated. But terrain theory looks at the state of the body's internal environment. So that means how the internal state of our body, our internal terrain, if you will, how it's functioning to be able to resist these pathogens getting out of whack. And so the role of microorganisms in terrain theory is that many of them are opportunistic. So they only cause problems when there's an opportunity in
Mm.
a in an unbalanced terrain to overgrow and cause illness. So they're seen more as secondary factors, these microorganisms, to developing disease, not the primary factors. And then when you look in this context and in a very naturopathic context, we want to work on maintaining a healthy and balanced internal environment to prevent disease, not just focus on killing the bug, which has its own consequences down the line. So this is what we see more in a holistic, naturopathic, vitalistic philosophy.
So, when you say balanced internal environment, what exactly does that mean?
Right. So there are, from a holistic view, right, we are mind, body, and spirit. And so for the purposes of today's conversation, we're going to focus more on the physical body. So the physical foundations of health, really optimizing those. If we want to throw up that therapeutic order poster, we can as well, the pyramid. And so we really want to optimize our physical foundations of health. So this looks like right here on the bottom. So establish the foundations for optimal health, identify and remove any obstacles to cure, and then
Mhm.
assess the determinants of health. So physically, the determinants of health look like a wholesome, nutritious diet, adequate hydration with clean water, exercise and movement. Our bodies are made to move. Restful sleep. This is where our body does its best restorative work. Breathing and connection with nature. So these all constitute the foundations of health and at the same time support our internal environment. And just a little plug here, even though we're not going to get into it too much, but from a holistic lens as well, our internal terrain includes our mind and our heart and our spirit. So what do our daily thoughts look like? What is our primary emotional state for most of the day or the week or the month? All of these things also have an impact on our immune function. So for example, if we are always rooted in fear or worry or stress, these things can dampen immune responses. And conversely, being rooted in gratitude and more elevated emotions can support our physical immune function as well. So these are part of our internal terrain. But with the physical foundations of health, there's so much that we can do here. And the tricky part is that when we come from a conventional medical model that's really rooted in germ theory and suppression, then it's harder to talk about terrain theory or supporting the terrain, because this is really more of a lifestyle and it's not always immediate. It's kind of our life path on earth to try to continue to grow and develop this type of lifestyle.
Right. So this popped into my mind. So we're in the northern hemisphere, and this is the season of increased susceptibility for all things coughs, flus, colds, fevers, just not feeling good generally. And one of your foundations is connection with nature. A thought that popped in my head is, well, in the southern hemisphere, they go through the holiday seasons. At least what the more Christian holidays, I guess, down in the southern hemisphere in the summer. I would like to pull that up. I don't know if you have any information on that, but if you do, it'd be interesting. Just side tangent. But the connection to nature is really important, especially here in the northern hemisphere, because we are not spending very much time outside typically because it's quite cold where we live, right? And
Absolutely.
what's the impact that has on our immune system?
Yes, perfect. So in climates where it typically gets colder, we have colder weather in these fall and winter months. Again, we we tend to term this cold and flu season, but is this really a season, or are there other factors at play, right? So especially like you mentioned, in places where it does get colder, there's a different effect that this has. So for one example, when we have less daylight hours in these fall and winter months, we have less exposure to sunlight. And also, you're going to work or it's cold outside. You might not want to be outside as much. Kids want to stay inside, for example. So you're getting less of exposure to sun and sunlight, which is crucial for our health. And by extension, vitamin D levels tend to drop. So if we're not mindful of this, vitamin D is a crucial component of how our immune system functions, right? It helps modulate immune responses. It helps make sure that the immune cells are working adequately and efficiently. So when we have less exposure to vitamin D because of natural cold weather habits, then we are increasing our susceptibility to illness. Another factor is during the cold weather, when we go outside and we're exposed, our nasal passages are exposed to the cold weather. One thing that happens is a localized kind of dampening of immune function in one regard, but also it temporarily inhibits something called mucociliary clearance. So our bodies can't, and what is that mucociliary clearance? It's how our respiratory system moves things along and gunk and junk from the body to come out to be expressed. So when you do have a cold, it's also a wise mechanism of the body to remove any junk in the system or remove any debris or pathogens away and up and out so that they don't have a chance to cause issues. Now with the cold weather, when you have this temporary arrest of that clearance, that's when things can get stuck or just kind of stay still for a little bit. And then, the nose and the mouth is a primary site of infection or entryway for pathogens, right? So again, back to germ theory and terrain theory, you want to take care of your internal terrain, but also the germs, the bugs, right, the viruses and bacteria, they can cause issue when there's susceptibility and when they have, better access to the body and a chance to overwhelm us. So when this is happening during the colder months, then the viruses that are kind of in these areas have more chance to linger and gain entry into the body. And then in addition, really the cold weather is typically drier and because of the lower humidity. So that adds on top of the picture where now you have this dryness going on, you're drying all that mucus in place. So really the picture here is less flow. And there's a lot of issues that come up when we have stagnation. So we want things moving, we want things flowing. Um, in the warmer climates, you're kind of getting more of that flow because you have more dilation of
Right.
the blood vessels and increased sweat and all these different things. So there is a difference.
Totally. So I'm hearing a few pieces of susceptibility, and most of them are surrounding by weather. So like when we have cold weather, that decreases our mucociliary elevator, the fancy way of saying like how our lungs, our upper respiratory system has the ability to like move things up and out. And so having boogers, having mucus, coughing, this is all our way of all ways our body says we're taking out the trash. We got to get this garbage out. And so then this is the trade-off, right? It's like no one feels good when you have a stuffed up nose and you can't breathe and your mouth breathing when you're sleeping, right? Like no one likes that. But then you take a cough suppressant or a mucus reducing agent, and you've just told your body the work that it's doing to take the trash out. Find a different way to take the trash out. We don't like this way. And I'm being crass, but it gets the point across. There are other pieces of susceptibility, though, too, right? And I like to talk about germ and terrain theory as kind of something that is integrated, and I love that you say that too, because we need to be exposed to the germ, to the thing that's making us sick, that, from the conventional perspective, the thing that's making us sick. And we also need to be susceptible. So now you add cold, dry weather on top of, I'm sure some of you guys have seen those memes that have gone around that it's like, it's not cold and flu season, it's candy season followed by cookie season, or pie season followed by cookie season. Plus,
Yeah.
we're not being outside. Plus, it's dry. Plus, it's cold. So we have like all of these things against us. And most of us don't increase the amount of time we're sleeping in the wintertime, even though it's much darker, much sooner. We're still staying up later. And then we also have holiday parties where we're maybe over consuming not just candy, but maybe alcohol. So now we're staying up past our bedtime. Sugar, it's dark, it's dry. Like it's just a recipe for our body to say, hey, we need to find a way to take out the trash, and like all of our usual mechanisms, we're having a hard time. So like you're going to be sick for a while now.
Yeah, exactly. The holiday habits, right? So we've got, and especially for the kids too, right? The Halloween in October, the pie holiday and Thanksgiving, and then Christmas cookies. And it's darker, you stay inside and you just want to, we tend to indulge more. And so high sugar intake, and these indulgences, maybe we're increasing our intake of ultra processed foods, alcohol, you mentioned, all of these things suppress immune function too. And so I
Mm-hmm.
think high sugar intake, right, it arrests the activity of our white blood cells, our main soldiers of the immune system, I think 6 to 8 hours after consuming a lot of sugar. So now if you have this exposure and it's lingering and the viruses want to take hold and you've just kind of overloaded on sugar, and the body is really struggling to try to overcome that. And now the pathogen has a great chance to do what it wants to do and spread to our other cells because of that susceptibility. So all of these lifestyle factors are a big part. Dehydration as well. We tend to think to drink more water when it's hotter outside, when it's warmer, and we forget sometimes to drink more water when we feel cold. But hydration
Mm-hmm.
is the mucus. It's what helps us detoxify the body. So all of these things together. And again, this is not to judge any of the listeners, right? We all want to enjoy the holidays, but it's
Mm-hmm.
being aware of the factors that constitute true health versus
Yeah.
the things that leave us more susceptible, and
Right.
trying to come to a lifestyle that really creates the life and health that we all want for ourselves and our families.
So what about kids? Is there a difference, especially in like our younger kids? Um, in your experience, do you find that they tend to get sicker in general because their immune system needs a chance to kind of strengthen? That's the way I talk about it with my patients.
Yeah, so different factors here. So typically kids how do I want to say this? There's a difference between what's common and what's normal, right? And so
Mm,
we kind of blur the lines where many people say, oh, getting this many colds or always getting sick or, um, right, kind of off track, but even having period cramps for women, like these are all normal, right? But really the word you want to use is common. It's
mm,
quite common, but it doesn't mean it's normal in the context of a true, healthy, functioning body and what our design was. So regarding kids, especially when they're younger, they do tend to get symptomatic a little bit more often, especially in those early years, because when a new baby comes out, they don't have a fully developed immune system. That has
mm-hmm.
to develop over time. A lot of that happens in the early childhood years, in infancy and toddlerhood, but it doesn't really complete until adolescence. So part of that training, that immune system training, is getting exposed to this plethora of viruses and bacteria that are all around us. We can't escape this. And
Mm-mm.
learning how to live outside of the womb now, and learning how to live on Earth with all of these natural components and exposures, and how to create an optimal response in the body so
Mm.
that when we go out in the world and we continue to be exposed to these pathogens and new ones, our bodies know what to do with them. We don't want to overreact, but we also don't want to underreact. So this is part of the immune system's development. So yes, for some kids, like you mentioned fever earlier, getting fevers are initially a way to train the immune system. And it's a really wise and brilliant mechanism of the body. After that, if kids are getting a lot of colds and are very symptomatic, is that truly normal? We tend to see, more of the snotty kids who are in daycare. We're like, oh, they're just exposed all the time. But we also want to broaden that conversation when we think about terrain, is what is their susceptibility as well? Why does
Mm.
this kid keep getting sick and symptomatic while some kids can do that once or twice and be fine? So why is my
Right.
kid constantly expressing something? Because ideally and normally, naturally, the immune system should be able to handle those things even without symptoms, asymptomatically. So this is going on all the time, but some kids just seem to struggle a bit more, and people in general.
Right. Right, right. And daycare is a great example. I hear about this just constantly germ factories, like don't touch anything. And, with what we went through a few years ago, there was this whole push of like kids can't be in school and it's very dangerous. And this is something that's so tough because we vitalist naturopathic doctors, we live in the world where most people, let's say 99% of people, it's pretty much everyone, is like the germ is the problem. And, yeah, well, we maybe know that we're not sleeping and we know some of these other pieces. We're not willing or ready to have that conversation because it puts a little more responsibility back in our body. We can do something about it. That's not just wait until there's a problem. And I'm treading carefully. And again, I'm not blaming or pointing fingers because I understand it's difficult and challenging. And I'm a new parent, it's sleep deprived. Like, I get it. Like, we're all doing the very best we can. And also, most people don't know that the fever is the immune system's response. It's the body's response. It's not because of the cold or flu virus that you have. It's because your body is saying, "Hey, we got this weird thing going on. We got to turn the heat up." I make reference to Osmosis Jones, and I pray that there's someone that has seen it. Please tell me you've seen it.
It's a blue guy, right?
Yeah, yeah, yeah. Well, it's like the immune system, and it's like this guy that like doesn't take super good care of himself. He's a well-known comedian. I forget his name, and so it's like the cartoon of the immune system going on inside this guy's body that doesn't take super good care of himself, and he has like a uh, food poisoning. And so the body's like, we're going to turn the heat up so we can try and burn this bad guy out of here. And, ultimately the bad guy like is starting to proliferate and, kind of gets into the immune system and starts doing his creating sickness. But regardless, it's a great example of actually how the immune system works, which I really appreciate.
Now I got to get my kids to watch that. I kind of just saw, I just remember, yeah, the reference, but yeah, it sounds really entertaining and educational, which is great always for kids.
Absolutely. Um, yeah. So
But
kids.
you talk about fever. So do you want to touch on that a little bit? Because I love what you said. It was a great introduction. So
Yeah.
the main takeaway I'd love folks to know about fevers, especially childhood fevers, is that fever is not an illness in and of itself. It's a symptom, right? Or it's a sign of the body dealing with an underlying infection. So usually viral or bacterial, right? And of course, as we talked about, when it happens earlier in life, sometimes this is almost like a rite of passage for children as their bodies and immune systems develop to overcome this initial exposure. And then when it happens later on in life, this is more like a detox process to kind of burn up whatever stresses and toxins are lingering in the body to get that out of the system. And I think Hippocrates, known as the father of medicine, was attributed to saying, what's the quote? Give me the power to produce fever, and I shall cure all disease.
Ooh.
Back then, right over 2,000 years ago, what were they seeing with adults? They were seeing, chronic infections or lingering situations that weren't getting healed, no matter what all the doctors and practitioners were doing. They then went to more psychiatric type of evaluations for what they had at the time, and nothing was working. But then they found that when an adult, an individual, then got infected with probably a viral or bacterial pathogen, and then they got sick and they melted fever, then when they recovered from the fever and that acute illness, their chronic condition or, paralysis or mania also went away. So then they started seeking out fevers as fever therapy. And so when it comes to children, it's a little bit different. They are, in almost all cases, fevers are beneficial and not harmful. It's one of the most effective defense mechanisms of our body. Essentially, it weakens the bad guys. So the bugs in our body, right, the pathogens, viruses, bacteria, they thrive more at normal body temperature. So the body increases, our hypothalamus increases our set point so that it makes an unhospitable environment for that bug to thrive in and replicate to cells. And then it strengthens our immune cells. It makes white blood cells work more efficiently and get activated. So, I could talk about fever all day long, but I love fevers. I've come to love fevers.
Yeah, and so I want to make a couple points. I want to talk a little bit about kids, but then I want to talk about the utility of fever, especially treating adults with chronic illness. So with kids, so I have a baby. We're taking him to a pediatrician, and they have on the little forms that when we check out, like, hey, if your kid has a fever of 100.3, please call us. And I'm just like, God, 100.3 is not very high at all. And maybe this is again for the lowest common denominator, a person that doesn't really know a lot about the body, right? And like I grew up with like fevers are super scary and you got to get rid of them as soon as possible. You can't have a fever by any means. Like that was definitely the way that my mom treated us when we were kids. Tylenol or whatever, like kids Motrin or something like that was commonly given to us. But the way that I talk about it, and again, we are doctors, but we're not necessarily your doctors. So keep that in mind. I feel very comfortable that if my son or if some of my pediatric patients I see, mom calls me and says, hey, my kid's got a fever, it's 102. These are things I'm going to ask them. Is the kid still, doesn't feel good, but are they like responsive to what's going on, right? And the temperature number doesn't actually matter. You could have a 104-degree fever and the kid's playing with blocks on the floor and they're behaving like a normal kid. They just have a really hot fever. Their body is like turned the heat up. They're burning that off. Now, there is a point where we worry about like febrile seizures, and 104 is where I start to be like, okay, mom, watch the kid. If you start seeing like the kid's behavior is decreasing, you need to be more mindful, then I have them give me a call. And we work together very closely, and I have my phone on. It doesn't matter if it's 2 a.m. Like that's the way I run my private practice for some of my families. Are those some of the main? So floppy baby, like kids not responsive, a super duper high fever, usually with that floppy baby. And what's the other red flag that I'm needing to think of here? You mind me?
Well, you always want to look out for dehydration, right?
Yes, dehydration. Thank you.
So yes. Okay. And love that you're a new mom and you're going to go through all these experiences, and there's nothing more educational than the experience, right? We can have the textbook knowledge, but nothing prepares you or teaches you more than the experience. So to share a little personal story, when my first child, my son, was born, I was in naturopathic medical school and we were still learning basic sciences. So when he had his first fever, we didn't get into anything clinical. We didn't have our maternity and pediatric courses yet. So when he had his first fever, it was between 7 and 9 months of age. I was freaking out. Like I knew I didn't want to give Tylenol or Motrin or ibuprofen, right? But I didn't yet know how to support him well,
Mhm.
um, to take care of him naturopathically. I remember one time like holding him up to the fridge. I'm like, you're so hot and you need to cool down and I don't know what to do. And it was very stressful. Fast forward to today, I have now a handful of kids. And when my youngest now had her first fever, it was like night and day. I remember she again was like maybe like 6 to 9 months old and she was nursing and going to sleep and her body was really hot. But my mindset was completely different because I
Mhm.
had more of an understanding of why the body was mounting a fever, that it had a beautiful healing purpose. And so she was laying next to me and I'm like, your body's doing so great. Like it's doing everything right. And I'm so proud of you. And I'm so excited. And genuinely felt this way. And it was so funny to think about the difference. And so my hope is for parents to come to that place naturally too. It is possible, even as doctors, when we have our first kid, it's like, okay, it's go time. And we have to go through those experiences as well with our kids, with our patients. Um,
It's
but
really testing that paradigm shift. And, it definitely is a little nail biting in some of the first cases that I've treated. But when you see that it goes so beautifully, like the way you're talking about with your youngest, it's like, it really is. It's like, wow, I am so impressed by this mechanism and the supportive modalities that we learn as naturopathic doctors and how well they work with kiddos, which is so awesome.
yeah, so you know what to do, and also importantly, you understand why it's happening, because
Right.
especially when we are first dabbling into naturopathic philosophy or naturopathic approaches, some of the, I don't want to call it a mistake, but what we tend to do is we take the conventional medical treatment framework and we put it on top of natural therapies. So we say, like homeopathic remedies or hydrotherapy or herbs. We want it to work the way that Tylenol or ibuprofen have this potent, suppressive and almost immediate response. And
Yeah.
when we don't see that, because that's what we're used to, that's what we've grown up with, we're like, oh, this doesn't work, or this is not doing what it's supposed to do. But when you understand that with fevers, you don't necessarily want to bring down the temperature as quickly as possible. That temperature is what's taking care of the bugs. It's what's keeping your child healthy and well. It's restoring them to normal function. So you want to support that fever. And that's where the naturopathic approaches are beautiful, because they're very supportive, they're gentle, they're looking out for harm and trying to mitigate, negative consequences. But at the same time, we're not trying to bring down the temperature unless the body's ready to do that.
Yeah.
So,
Yeah, and some ways that I've used in my practice with my kiddos is like neutral baths. Like, okay, your kid's really uncomfortable, they're hot, they're just like we've I remember having a fever like that when I was a kid too, just like super uncomfortable, and putting them in a neutral bath. Not a hot bath, not a cold bath, but like kind of what we would expect a body temperature bath to be, 98 to about 100 degrees Fahrenheit, and having them kind of get that like just a little bit of relief from that fever. It's not suppressing the fever, it's just giving them a little bit of like, can we calm things down for a minute so that maybe they can get to sleep and that they can burn that fire down.
yes. And you mentioned, yes, so warm tepid baths, the warming sock treatment, which is a very naturopathic, recommendation. I'm sure you can just Google that and find some information, but it's, cold, wet socks on the feet, cotton socks covered by wool, so to kind of insulate that. And the body is trying to work through the night to heal up those socks, and it stimulates blood flow. And with blood flow, you're getting more
Yeah.
activation of the immune system and the immune cells moving beautifully. So it's very natural and gentle, and supportive.
And
And at
if
this,
you don't have kids' wool socks, this is definitely a common complaint. Grab dads, grab moms. I don't care if the sock comes up past the kid's knee. That's okay. That's very okay to do. And most kids, I'm pleasantly surprised that most kids are like amenable to putting cold, wet socks on their feet.
they
And you don't
are.
want, they don't need to be frozen. They don't need to be soggy. Like you get them tap water cold, wring them out really good, put them on. They're uncomfortable for like 3 seconds. And then they're like, oh, this is this is fine. You put the wool sock on that looks like a pair of pants, and then you get them snuggled in. And about halfway through the night, a kid will kick them off, or an adult will kick them off. And what's really crazy, and I don't know if you found this to be true, Jinmee, is the cotton sock will be like crispy dry, like it was on like a clothesliner. Like that's how hot and warm our body can able to dry that sock.
And they sleep better. And then, my kids and patients of mine have started to, moms would tell me, my kids ask for it now. They're like, can I have the wet socks? And it's really cute. So they start to learn, and they will take this knowledge with them, right? We will be
Yes.
those practitioners, but also parents and moms and grandmas with those fun remedies that the kids will remember too.
Yeah.
One thing you mentioned too is, so with febrile seizures, this is very scary for a lot of parents.
Super
And
scary.
very scary. Don't wish it upon anyone. Typically, when they happen, it's more. It's not that febrile, just getting a fever increases your risk of having the seizure. It's more, we see them more. I think it's less than 5% of kids will experience this. We tend to see it more with not how high the fever goes, but how rapidly the fever initiates. So it's more due to rapid onset and how quickly the body is kind of ramping up the internal heat versus, how high the fever ultimately gets. And, taking suppressed or antipyretics, Tylenol, Motrin, these things don't prevent having a seizure if the kid's going to get one. And one thing that's not commonly talked about that I want to bring up because it's important to think about is, in my mind, there's a more susceptibility to having febrile seizures when the child has maybe an existing mineral deficiency. Because when you
Oh,
have different mineral deficiencies, then this can increase neuronal excitability, which kind of leads to a propensity for seizures, especially in that increased metabolic demand state of a fever. So there's not a whole lot you can do, when the fever is on and the child might be, having a seizure then. But it
right.
also comes back to that bottom of the pyramid, our foundations of health. How do we support the child, make sure that their nutrient levels, their vitamin and mineral levels are optimal by how we are feeding them and supporting them naturally so that when they go to these immune expressions, that they can be well supported or more resilient when these things come up.
Interesting. That's something I have not heard, but it does make sense, thinking about the physiology of how a fever happens and the minerals that we need. And we're talking minerals on the periodic table, but these are things like magnesium and sodium and potassium and calcium and whatnot that we need for our body to be able to do its job efficiently. And, even eating a really good diet, unless you're really seeking out regenerative farmers, it's really tough to make sure you're getting all the proper nutrients. And man, I have really wrestled with this. It's like I don't know if you agree that a good multivitamin is appropriate in most instances, but I have kind of come to that like center point. What do you think, Jinmi?
Yeah, it was so hard. I resisted it for so long. I'm like, why can't we get everything from food? Like, I hate taking, even if it's natural, even if it's a vitamin. It has always felt weird to kind of take something supplemental. But seeing more and more, especially in modern life, that's more beneficial than not for most folks. Of course, it's best when you can to test and find out the individual nutrient deficiencies and supplement accordingly. But when that's not
Yeah.
available, it's just easy to fill in the gaps with the diet with a good multivitamin.
Yeah,
But
for sure.
recommend it.
So I love that we talked about febrile seizures. My brother had a febrile seizure, and man, I do think you're right that it was like very rapid onset. Like he was fine. We went out to dinner as a family, and then we came home, and all of a sudden he was not in good shape. So that's interesting to pay attention to. And I think Seattle Children's Hospital has a great video on pediatric or on febrile seizures that it's free to the public if you are interested in finding it. You know, the internet is full of all kinds of wonderful things and also horrific things. So just be mindful when you're looking online for things that you're probably going to find you can't unsee and unhear. I'll just leave it at that. So fevers in kids really manage not only with hydrotherapy, but some of the tools I've used with my patients have been homeopathy. And I know homeopathy is very controversial, but I don't care because if it's working, when I say working, I'm not saying like their fever is gone, but it's like suddenly they go from crying and like arching their back and they're really upset, and then you give them a remedy and like they're just a little more at peace and they just feel a little more comfortable and they're not so aggravated. Is that
Yeah.
the homeopathy working or is it placebo? I don't know. Generally, a 7-month-old baby doesn't have the predispositions and the conditioning that you and I even have, let alone general public that is like homeopathy, you know, and I just go ahead and call it, yeah, this is a magic sugar pill. Like if it's going to work, it's going to be great. And I'm being trite with my statements, but you know, it gets the point across that it's like this is good stuff when we get the right stuff, right remedies. And with these acute illnesses, homeopathy works so well in kids. Is that a similar experience that you've had?
Yes, homeopathy. Right, it's an elusive one for many people. It's still sometimes hard for us as practitioners to explain
100%. I
how it
feel like
works.
I figure it out, and then I'm like, I have no clue.
Yes, and it's another one of those things where when you have the experience of it working, you can't beat that. You can't deny it. Again, the placebo effect, if that were really a factor here, then again, yeah, kids, then why do kids and animals respond so well to that? Even infants who have no concept of what you're giving them and what it means, even
Right.
plants can respond to homeopathy. So essentially, the way I like to sum it up for patients, the example I use to describe it. So homeopathy is they're diluted remedies made from a plant, mineral, or animal substance. And homeo, right, means same. So you're looking for a symptomatic match. So what does that mean? Okay, so Shayna, if let's say you or someone you know overdosed on coffee or caffeine, what symptoms might they present with?
Feeling a little stressed. They might be sweating, red face, kind of feeling anxious, tight tension, and not being able to sleep is a big piece.
Being able to sleep. Yeah, exactly. All those things, maybe a little bit anxious. And so now you have someone with that picture, they've overdosed on coffee, but now you have a completely different person who has all those same symptoms, right? The anxiety, the insomnia, the sweating, the rapid heart rate, all these different things, but they've never had a drop of coffee in their life, no caffeine. So you have a person who's unwell that's exhibiting this symptomatic picture. Now you take the remedy coffea, which is from the coffee bean, and it has this kind of signature of symptoms, and you give
Hmm.
it such a dilute dose, which is a little bit of an energetic imprint. Also, the nanoparticles, they've done research, kind of interact with our biology. You give that to the person who's unwell and exhibiting this combination of symptoms, or
Hmm.
and that's enough to kind of push out the dysfunctional expression. Kind of like taking two positive ends of a battery and putting them together, they will repel each other. So
Right.
when you give a little bit of that same picture in a homeopathic form, and it's matching the symptomatic picture of an unwell person, it kind of gently pushes out that expression so that person can normalize and come back to their normal state. So with fevers, sometimes we can see this too. Um, the little caveat here is I want to stress again that the body is not going to do, homeopathy is not going to cause the body to do anything it's not ready to do yet. So again,
Right.
if we take the conventional model of like, I want to bring the number down on the temperature. If the body has not finished its important job of killing the bugs, taking care of them, minimizing their spread, and them wreaking havoc on the body by elevating the temperature in the first place, then the homeopathic remedies are not going to cause the body to go against its wisdom and drop the temperature. However, if the body is ready and at a stopping point where it's ready to resolve, sometimes the body can get into a place where it's done doing what it wants to do, but we kind of get stuck in a little pattern. So then when
Right.
you introduce homeopathy, it can kind of gently say, oh, remember, I'm ready to do this now, and
Mm.
support it. But it's not going to act like a drug and, chemically influence the enzymes and the immune components that change the hypothalamus' set point in the body. So with that said, there are some remedies that can make your child more comfortable, right? So especially if a child, I like to reserve homeopathy with fevers for those unique cases where, um, because hydrotherapy and these other things work so beautifully already. Um, so, for example, if a child is really fearful or anxious and they just can't rest because they're so scared, some kids have this expression where they're just like, "Am I going to die?" Or they just are freaking out. This kind of matches an aconite, the remedy aconitum, homeopathically, along with other things. They're very thirsty for cold drinks, and especially if this is unique, like your child is normally not very thirsty, or they,
Right.
drink water normally, but now during the fever, this acute expression, they're like, I want water all the time. They're sipping it the whole time. So you can match that with aconite, and that can kind of let them be less fearful so that it can relax and go to sleep. Belladonna is another big fever remedy. And I like that one, especially when I hear parents say, whenever my kid gets a fever, they're hallucinating or they're delusional or they're like, there's weird stuff going on. And I'm like, oh, that's very belladonna. Belladonna also has
Mhm.
very hot expression, very hot body, like the heat's radiating off of them. It can be very intense. So, but when I hear that kind of delusional, hallucinative picture, then I'm thinking, hey, just let's give a little bit of belladonna and see if we can ease some of that that's going on. So those are kind of two of the big ones.
Yeah, and I just want to reiterate, like, one, we're not pushing the body to do anything it's not ready to do, and two, these are helping to ease so that the body can do its job more efficiently, whatever that looks like. And no one wants to see their kid sick. No one wants to see their kid uncomfortable. And that this is what's so great about homeopathy. Both of those remedies, aconite and belladonna, they're plants. And I had a parent that was like, belladonna, isn't that like deadly nightshade? And that's what's so great about homeopathy. So we talked about coffee, and I really love that example because most people know someone in their life that drinks a little too much coffee, and they get really wound up, really tight, and they talk like this, and they're like really red, and they're just running a marathon, and they're just sitting in their chair next to you, and you're like, what is happening? Um, and that is definitely overdosing on coffee. And so giving that example, I think I will start using that. So thank you for that. The picture of overdosing on belladonna would look like delusional, hot, intense. And then
Mhm.
we're giving the beautiful homeopathic remedy that has none of those substances. It's an energetic imprint so that it can help the body clear that and let it go, so that the body can continue doing the fever job and let that go, so that when your kid wakes up in the morning, they're like, "Oh, I'm so glad. I feel so much better." Like it is very cool to see it be that effective.
Yeah, they can sleep, right? It allows them to
Mhm.
aconite picture less to be less fearful, or kind of ease some of those delusions and hallucinations, and just get them to sleep, which is when our body does its best restorative work, right? You definitely go along with the recommendation to try not to wake your child if they're sleeping during a fever. This is typically with giving them Tylenol or what have you, but you don't want to do that. You don't want to do that even with our natural supports. Let them sleep. Sleep is so incredibly restorative. It's so supportive for our immune system, child or adult, fever or not, right?
Mhm.
Sleep.
God. Yeah. Adults getting fevers, though, not a very common thing. And I don't know if we want to do this deviation because it might be a little bit of a longer one. And I do want people to have um, more of these tools for this terrain dysfunctional season. So maybe we'll save the chronic fevers for another time. But fevers in adults are very important and also should not be suppressed. I'll just say that.
Yes. Mhm.
So some of the other things that kind of come up during this time, like the coughs, right? Like things like whooping cough and croup. They sound terrible. A seal barking cough, and it's scary, right? Again, like we've been conditioned that when our kid gets this, And also, it's scary from a parent's perspective. My kid is sick, doesn't feel good, and then we have this conditioning that, oh my god, my kid has whooping cough. Like I should be very concerned and scared. And yes, kids can get whooping cough even if they have been vaccinated. That is one of the vaccines that doesn't have a great efficacy, and that's why they pair it with diphtheria and tetanus in the which one is the kids one? Is the DDAP? I think the DTAP is the kids version, right?
Yes.
And it's like that's to hopefully help it be a little bit of a more have a more robust reaction with the immune system, because tetanus and diphtheria, that's a pretty well-rounded set of vaccines. um, I had the pleasure of treating a croup case last season, and it was a really beautiful case that we did homeopathy and hydrotherapy with, and some herbs too. I wanted to make sure mom had tools on board to help support, and then if this happens, these are what you can do to help support further. And we used three. She was like, you said that we would go through the remedies 1, 2, 3, and that's exactly what happened. And so mom is pretty convinced at this point that like what this medicine is so helpful, and she's just so pleased that her daughter has made it, however old she is now, and hasn't had to use antibiotics, and she's very happy about that. Not saying there
Well,
isn't a time and place for antibiotics, right? But if we don't have to use them, we don't need to use them.
exactly. Yeah, I'd love. Can you share what you did? Because I remember you sharing that with me before, and it's
Yeah.
just awesome. And of course, every child will need something different. That's individualized care. But what did you use?
Right. So, like I said, I wanted to make sure she had all the tools on board. So, neutral baths were something to help because kiddo tends to get really high fevers, and isn't upset, but just like if mom wanted to bring the fever down just a touch. Um, Throat coat tea. I recommend throat coat tea for a lot of things because it's really accessible. You can go pick it up at whatever grocery store in the tea aisle, and it's great for fill in the blank conditions.
Yes.
And again, that's just like to help soothe that sore throat from coughing so much. And then the three remedies that I had her leave my office with were aconite, which we just talked about. And there's this
Mhm.
fearfulness piece, but it's also the one of the most acute remedies. And the way I think about it is it if you can give it to the patient within the first 24 hours of the onset of the condition, it's going to have a better efficacy in my experience. And it acts very quickly and leaves the body very quickly. The second remedy I had her take was spongia. And this is for that really dry, like barking cough, which, anybody that's heard a croup cough, you can go on YouTube and like listen to croup sounds. It's terrible. And she was sounding terrible in the office. And again, we assessed her and made sure there was nothing more significant going on. Like, yes, this is croup. These are the things to do. And then if she gets very, very cold, which can sometimes happen, I recommended Hepar sulf. So Hepar sulf is one of our coldest remedies, and that cough is just so dang painful. So there's an evolution of the illness that can happen, and we all see this, right? Like kids feeling okay, they start getting body aches, now they're coughing, and now they've got a fever, right? Like however that stepwise goes, that's what Jinmee was saying, where there's some individualization that we need to make sure. So while these remedies worked for this particular case, it may not work for your case. Would it be a good
Right.
idea to have aconite on board, on hand at home? Absolutely. It's a great remedy. You hear a car accident, take aconite, right? And then the other thing I had her do, and mom did say she didn't need to do the mustard packs, but it's a good thing to have in the fridge, or excuse me, in the freezer just in case, is a mustard pack. And this is an old naturopathic technique. It's actually old hydrotherapy. And you take ground mustard that you may or may not have in your spice cabinet that's been sitting in the back of it for ages, and you take a piece of gauze. What is this, like 2 by 2? Maybe that's 4 by 4. 2 by 2 for like a little kiddo. And what did I have her do for the paste? Some recipes say egg white. I don't really like using egg white because so many people have egg intolerances and allergies. But you can make like a paste with cornstarch and mix the mustard powder into that and let it set in the gauze. This is why having a few of them made up ahead of time. This was a remedy that we used in a pertussis case I worked with as well, and it worked really, really well to help heat that chest, to open up the bronchioles so that cough can be more efficient. Remember, we talked about the mucociliary elevator, that mechanism in our body to take out the trash isn't working as well. So when we help to open up the bronchioles, it helps to
Yeah.
help the body move the trash out more efficiently.
So you're putting that gauze on the skin and letting
Mm-hmm.
it, yeah,
Yeah.
interact with the system there.
Mm-hmm.
That's so cool. That's so awesome. And now you have a convert for life. It's like, wow, these things work, and that's amazing. Yeah.
Yeah, exactly. What kinds of things do you see be helpful for the coughs out there that you've worked with?
I think, well, homeopathy is great, and it's hard to kind of give a synopsis of which remedies to use, right? Because again, it's very individualized. But
The dry
hydro,
versus wet cough, right? There's so many pieces.
yeah, the teas are amazing. I love throat coat tea. It's so good for, like you said, so many things. Put a little bit of honey in it.
Hmm.
Hydrotherapy, maybe around the neck or the chest to kind of do flow and open up the system there, because you really want that stuff to
Yeah.
be more supportive and gentle. Lots of
Would you
rest.
do would you do warm or cold or both? Like, what's kind of your process there?
Yeah, a lot of the times for many conditions, we think of contrast hydrotherapy. Um, and so, or warming compresses. When
Hmm.
there's more, so in this case, for a cough, I might think of contrast hydrotherapy, so hot and cold alternating. But really, more, especially in this season, you want to think more about warming because, again, we're already typically congested, or if you have constriction in the bronchioles or the blood vessels, you want to, people are struggling already. You want to kind of help open things up and dilate a little bit more. So warming, a nice hot shower, steam inhalation if you, depending on where the situation is and what's going
Yeah.
on. Warming can be very soothing, and putting a warm cloth on the face if there's congestion as well. Um, yeah, especially during this time of year if it's colder.
Yeah. One of the things I often recommend for folks, and you made a mention of this, is like the cold weather is much drier. And then we're sitting inside our house more and we have forced air. And so we have multiple things that are making things much drier. And then I live in Colorado where it's literally negative humidity most of the year. Getting a humidifier. And you don't want the humidifier running on full steam. They have all these like smart ones now that'll be like, oh, you want it to be at like 40 to 50% humidity. And that's enough to help moisten our nasal passages, moisten our throat so that we have that less susceptibility because Jinmee mentioned that, hey, these viruses and these bacteria, they're lingering because we don't have any flow because there's no moisture as I'm feeling my nasal passages be very dry, right? It's like, what can we do to help support that? Do you need to have a humidifier running year round? No, I don't. I don't generally like mine to be running in the summer. Have one that's in your bedroom and you can have it running during the day. Turn it off at night if the sound disturbs you. Some people like the white sound. I am not one of those people. And do you use humidifiers? Is Maryland's probably pretty humid, huh?
It can be. Yeah. I'm used to New York, like upstate New York weather, and it's completely different, right? It gets warmer. It's warmer here, so it's kind of a nice change for winter
Mm.
time. But it still does get cold. But a humidifier, yes, is great. And I had a patient recently tell me, he travels a lot internationally, and he was down in South America, and he was kind of fighting something and had all this. Cough congestion going on. But then when he went to South America, he's like the heat and I definitely noticed a difference there, and I felt a lot better and was able to clear things up. And then as soon as I landed, back here, things kind of hit me again. So the
Mm.
humidifier is great because you want to introduce that moisture. And kind of more warmth or flow. We want flow, right? We don't want to suppress. When you suppress, whether it's a cough or any of the secretions of the respiratory tract, you're kind of pushing that secretion or that expression to bring the junk up and out of the body, even with a cough, deeper in the body, taking Dayquil and NyQuil and all these things. And then you're potentially driving those pathogens deeper. And now you can run into a situation where you run into a secondary bacterial infection or pneumonia later down the line. And we don't connect the two because it's like, oh, I'm comfortable now and I feel better. But what were the consequences of that? So
Right. And
kind of.
it might not be immediate. You could end up with pneumonia or something later, like the next time you get sick, like the illness is deeper in the system. When we say deeper, it's like, yeah, we need our throat to breathe, but our lungs are even more important. That's a vital organ, right? Like our throat, we have all these methods to get crap out of our body. Our lungs, that's very an important organ. Um, One of the things I'm a big herbalist. I really love using herbs in my practice. And again, I like to make things be accessible. And there's a brand called Wish Garden. I have no affiliation. I just love their formulas. They taste good, which is always tough sell for getting kids to
Yes.
eat herbs, is they don't always taste good. Um, cherry bark. Cherry bark is used as a cough suppressant. So let's kind of parse this out a little bit. But an herb is suppressing, is it doing it the same way that like Dayquil or NyQuil does? No, it doesn't. However, if your kid is up coughing all night, mom, dad aren't sleeping, kids not sleeping, no one's sleeping, you need to get to sleep. So taking something that takes that edge off so that we can get into a restful state so that everybody's feeling a little bit better in the morning, that's an important thing. And I'm not saying never take Dayquil or NyQuil. Well, I may not do that because that's just, I don't need to do that with my body. Herbs work very, very well, and cherry bark is no exception. And getting some cherry bark, and it's not usually a simple or solo herb; it's usually mixed in with some other things. Um, I can't remember Wish Garden's cough one, but they've got one for wet coughs and dry coughs, just depending on what type of cough. And a wet cough would be like you're hacking stuff up, it's coming out, it's a productive cough, versus a dry cough, kind of more like that croupy, like just really irritating to the body. Do you
Well,
ever use cherry bark with your practice?
a quick note there. Do we want to, if we can throw up that pyramid, the therapeutic order again?
Oh yeah.
This is a really interesting point. So yeah, cherry bark is great for coughs. And when we look at this pyramid here, okay, so herbs, many times when so up here we have kind of in the orange, natural symptom control. So using natural substances to palliate. So, a trained herbalist or a naturopathic physician who is educated in herbs and how to use them and their mechanisms of action, we
Yeah.
can know when we want to use them for, palliation, or like you said, to get people to sleep, or just so that we're using something less synthetic, which is right above it, right? Synthetic symptom relief using drugs and over the
Mhm.
counter situations to palliate. But we also know when to use them more gently, kind of lower down in the green, to be more stimulative and gentle instead of suppressive. So not that cherry bark necessarily has a suppressive effect, but you can kind of soothe the area so that you can get that rest that you need to finish healing.
Mhm.
And one thing to bring up as well with this conversation of herbs is, again, if we take a more conventional model and approach to even using herbal medicines, sometimes like for fevers, for example, which we were talking about, you can use diaphoretic herbs, which are herbs that help promote sweating, diaphoresis. And so you're promoting the body to sweat and reduce heat. Typically, naturally, normally with kids, you typically see sweating towards the end or resolution of the fever, because after
Mm.
the body has gotten all, dealt with the viruses and all the byproducts and the toxins generated from that now want to come out through either having a bowel movement or sweating through the skin, because the skin is another detox organ. So that those toxins come out through the sweat. And then at the same time, you're releasing heat through the sweat, and that allows the body to cool down. If you use strong diaphoretic herbs during fever, for example, like yarrow, too early on, or kind of inappropriately, then you might be encouraging the body through this natural symptom control using herbs to sweat too forcefully or too soon. And now you're causing the body to release heat and maybe lower the temperature. But when are we
Mhm.
doing this? And so we want to be mindful of that, and a naturopathic provider can be more aware of those things. Usually when we use, yarrow or typically catnip or these other diaphoretic herbs for
Yeah.
fever, for example, they're in gentle teas and they're more supportive, and they're not going to have this really suppressive type of action, and they're
Mhm.
very gentle. Have other components within the
Yeah.
herb, right? With the
Yeah,
drug.
herbs work in synergy, and I say this all the time. Herbs like friends, and when you pair yarrow with catnip and some chamomile and some marshmallow or whatever else, it makes a really nice marriage.
Yeah.
We got to wrap up. An hour always goes by so quick. Um, we talked about fevers and coughs, and we talked about the difference between germ and terrain theory, and how there is actually a marriage there as well. That you need to be susceptible. And we talked about the various components of susceptibility that happen here in the Northern Hemisphere during the winter months. And you have to be exposed. So it's multiple factors. It's not just, oh, that Billy Bob has a bad immune system. So having a balanced train, and kids having a fever, especially the younger kids, when they're learning, their immune system is getting trained up, a little bit different than when an adult or an older child has a fever. That's the body's natural response to the thing that it's trying to get rid of. And it's saying, hey, we got to burn up, we got to turn the heat up so we can burn this bad guy out and take out the trash. And while we understand that, snotty noses and coughs and sore throats, they don't feel good. No one likes them. No one likes vomiting. No one likes diarrhea. These are the body's ways of taking out the trash. And while there's a time and a place to like decrease that so that we can get some sleep, for example, we need those mechanisms. Otherwise, we run the risk of having more severe, like pneumonia or asthma or something that's more chronic, kind of come later in life, and we don't always make those connections. We talked about homeopathy, and I really like Jinmee's example that she gave, someone that overdoses on coffee and then you give them the remedy coffea. Homeo means similar, doesn't mean exactly the same, but like, hey, coffea homeopathic is coffee bean, and it represents that symptom presentation of, we all know those people that drink a little too much coffee. And a big tip is using a humidifier. That really does help. And some of these fancier ones, like I said, you can kind of set the humidity to 40 to 50%, and that will reduce your risk of getting colds and flus quite substantially. There's some data, I can't remember which study it was, but it was like 41% reduction in flus and colds, which is a substantial amount. And sweating, this is a fun thing. Sweating happens at the end of a fever just before it breaks. So that's something for us to keep in mind. Of course, find a naturopathic practitioner, someone in your area that's very familiar with this, that can help walk you through, because it's scary. Jinmee shared when she had her first, and she knew there was another way, but we got to cool the baby down in the fridge, right? It's like, it's hard to untrain our mind when we are so used to the conventional modality for dealing with these things. Jinmee, where can people find you if they want to get in contact with you?
Yeah, sure. I'm on most, kind of all the common social media sites and YouTube as well under Dr. Jinmee Graham. My website's drjinmeegraham.com to get notified on other resources. I have a fever ebook coming out, so it talks about everything we talked about and more. And I'm really passionate about natural immunity, so more of that stuff will come on the YouTube channel. But typically, yeah, those are the spots.
Natural immunity. And I just want to put a page in for that fever ebook, because then it really will help you feel more comfortable dealing with fevers. And, this is from a practitioner. We have the experience, and kind of give you that walk through, which is what I do with my patients too. If this, then this, if that, then this. I'm not sure who my next guest is going to be. We will find out. But if you guys really liked this episode, like and subscribe, share it with a family member that's maybe got kiddos, or, if you find this controversial, we talked about homeopathy, we talked about fever, and, Google AI says, hey, you're supposed to use antipyretics. Who are you guys talking about, supporting the fever? You guys crazy? Like, let's have a conversation. Let's talk about it. That's how I learn. That's how all of us learn in my experience, but I'll speak for myself. And, I do this because I really enjoy doing it. I love sharing naturopathic medicine, especially vitalistic naturopathic medicine, to help people know that there are other options out there besides just taking a pill every time you're chronically sick or every time you have a fever, or cough, or cold. There are other options out there, and they help you feel better quicker, and whatever, give you the power back so that you're in charge. It's the people's medicine. Thank you so much, and I'll see you next time.